The press often calls Kleine-Levin syndrome sleeping beauty syndrome, implying a peaceful slumber. The clinical reality shatters that imagery. Kleine-Levin syndrome, or KLS, is a rare and severe episodic hypersomnia disorder. When an episode begins, the body enters a state of systemic disruption. The hypersomnia is extreme, with sleep consuming 15 to 20 hours a day for weeks at a time. During the brief windows when a patient is awake, they exhibit severe disorientation, states of profound apathy, and stark cognitive slowing. These waking periods are accompanied by extreme behavioral anomalies that often make the patient completely unrecognizable to their families. Because these symptoms overlap with other conditions, initial clinical observations are often baffled, resulting in frequent misdiagnoses. KLS is a localized, transient neurobehavioral syndrome. Analyzing this symptom cluster identifies a failure in the brain's autonomic control center. KLS represents a structural failure of biological regulation. Onset typically occurs during adolescence, and epidemiological data indicates the disorder disproportionately affects males. The initial episode rarely happens spontaneously and is usually precipitated by a distinct environmental stressor. Clinical triggers include significant psychological stress, heavy alcohol use, or severe sleep deprivation. Most cases are preceded by a viral illness occurring shortly before the onset of hypersomnia. This supports the hypothesis that a viral infection sparks a localized autoimmune or inflammatory cascade within a specific brain region. KLS behaves like a post-infectious inflammatory storm, targeting autonomic regulatory networks. The suspect region is the hypothalamus, located within the diencephalon. The symptoms of an episode form a triad: extreme sleep, appetite changes, and behavioral shifts. Hypersomnia, reaching 15 to 20 hours of daily sleep, originates in the hypothalamic regulation of the sleep-wake cycle. Hyperphagia, compulsive, excessive eating, corresponds to the failure of the brain's appetite control center. Finally, the hypersexuality, irritability, and social withdrawal reflect a breakdown in the regulation of instinctual drives. These symptoms share an anatomical origin in the hypothalamus. This specific triad indicates a transient neurotransmitter imbalance in this region. The clinical presentation reflects an acute, localized hypothalamic shutdown. Beyond the acute symptoms, KLS is defined by its specific temporality. The syndrome is strictly episodic, with pathology contained within discrete timeframes of days or weeks. Between attacks, patients return to a baseline of completely normal cognitive, social, and functional states. This graph compares the KLS timeline against chronic conditions like idiopathic hypersomnia. While chronic disorders show a steady baseline of symptoms, KLS is defined by severe spikes that drop back to zero. Diagnosis is a process of exclusion that relies on this longitudinal history, and polysomnography is the primary tool used to measure sleep architecture. During a KLS spike, polysomnography confirms drastically increased total sleep time. Between episodes, the polysomnography readouts show normal sleep architecture. This normal data between episodes effectively rolls out chronic sleep pathologies and ongoing psychiatric disorders. The clinical marker for KLS is the normal silence between episodes. There is currently no definitive cure for KLS. Management focuses on supportive care, prioritizing safety, nutrition, and hydration during acute phases. Stimulants or mood stabilizers are sometimes used, though their efficacy is variable. The functional impact is severe, as unpredictable episodes derail education, careers, and social development. Fortunately, KLS is known as a self-limiting disorder. Over an 8 to 12-year period, episodes spontaneously decrease in frequency and intensity until they cease altogether. The disease reveals the raw wiring of the brain's primal drives. Kleine-Levin syndrome demonstrates that sleep, appetite, and consciousness are intertwined nodes, vulnerable to a single point of failure.